Healthcare is expensive and out of reach for millions in India. There's a dearth of doctors. Is long-distance robotic intervention the solution? Hey, take a look.
Internet bandwidth is being used from a far distance, and the commands are given from a far distance to fix the block, to balloon the block and to stand the block where the patient is 32 kilometers away from this place in Apex Heart Institute, which we have done.
India has become the world's first country to perform a tele-robotic coronary surgery. Dr. Tejas Patel from Gujarat performed the intervention on a middle-aged woman sitting 32 kilometers away from the patient.
I'm just pulling it back. Instead of transferring this case and risking the patient's life for transfer, a senior person from the city, can be called for, and you can, open, the console and fix the block remaining 100, 200 or 1,000 miles away from the patient.
Doctors are excited, saying the success of this study will pave the way for large-scale, long-distance tele-robotic surgeries. And while it might be a milestone worth celebrating, the challenges are many.
Our goal was to provide access to care to communities that didn't have specialists to be able to treat patients who are suffering from heart disease or closed blood vessels in their brains.
Number one, the procedure is not cost effective. Number two, the patient still needs a competent doctor around when the one performing the surgery is miles away. And lastly, and this one is extremely important, India has a long way to go in ensuring reliable internet connectivity. There is also no way a tele-robotic surgery can be performed without foolproof internet connectivity. But for now, Dr. Patel and his team can revel in their accomplishment. Bureau Report, Wion, World is One.
I have to miss 3 days of work, and I have to travel on the plane. It's kind of like a lot of work. It's kind of stressful. My kids are so attached to me. I would take them with me, but the plane fares are so expensive.
Hello.
Hi. Hi. How are you ladies doing?
Good.
I'm Nadine. I'm a sonographer here at the Ultrasound Center in Saskatoon, and we're just gearing up to do a telerobotic ultrasound scan in Stony Rapids. When the patient arrives, we basically take control of an ultrasound probe using our technology here. I can scan a patient that's not actually at the bedside here beside me. The feedback has been very positive from patients. They are happy to be able to stay in their home communities and not have to make a trip in that can be very costly and a burden on their time. So they feel very thankful to have the technology being brought to them in their own community.
Oh, excited. Can't wait to meet my little one. It's kind of emotional.
Maybe little arms kind of waving at you here. Here we can see baby's little heart. Baby just moved out of the way a little bit there. Hey, this little one is pretty grown up. Kind of a shy little baby. Well, congratulations and all the best to you going forward.
Thank you.
Yeah, you're welcome.
This is really going to help bridge that gap between the disparity that we see, because geographically there are thousands of kilometers between us. So by bringing us to them, it's been pretty amazing the types of pictures that we can acquire.
Oh, look at that little nose. I'm just happy that that's my baby. Can't wait. I just can't wait to meet him or her.